We're all human. And it's important to know that doctors are people too. Doctors have emotions, they have passions in life and hobbies, and they enjoy participating as active members in the communities where they practice medicine. Doctors have families, friends, and relationships, while the latest in healthcare and the most current treatments for ailments will be topics on this Doctors Are People Too radio TV show. The focus will be in learning more about the interesting aspects in a physician's life and what they do away from the doctor's office or operating room table.
Hello, South Florida and beyond, and globally on the iHeartRadio app. Welcome to Doctors Are People Too, and this is also a TV show, as the opener mentioned. We're going to be on amp2.tv on YouTube, so you can check out that channel probably tomorrow after the show if you want to see it again. We're so lucky tonight because we have Dr. Amy Jarvis, a neurologist with the Miami-Dade Neuroscience Institute. That's mdnineuro.com. She's the stroke medical director at North Shore Medical Center in Miami, and we're going to touch a lot on the brain tonight. So with further ado, Dr. Jarvis, how are you doing tonight?
Very well. Nice to finally come on your show, David. I know we've been trying to get this together for a while.
And thank you for coming aboard on Doctors Are People Too. I've been just fascinated with your work since you came on board at the Miami-Dade Neuroscience Institute. And I wanted to bring you on with the listeners because you have a very vast areas of interest in neurology. And I think if I just ask you, it'd be better off. What areas of interest do you focus in there at the Miami-Dade Neuroscience Institute?
Well, we do all areas of neurology, essentially. But for me in particular, my training, my specialty training, fellowship training, was in stroke. And then I have so that's vascular disease. And then I also have a very serious interest in training in neurocritical care as well as migraine, et cetera. Excuse me. I've also dabbled in neurotrauma and concussions, et cetera. When I was in Jacksonville, I was a neurotrauma consultant for the Jacksonville Jaguars. But here at the MD&I, we basically do everything. But like I said, my particular interests are stroke and vascular disease as well as migraines.
Let's stay on that topic of migraines and then headaches, because it seems to be always in the news. We know it's a fact that Dwayne Wade, formerly of the Miami Heat, and unfortunately now the Chicago Bulls, suffered from migraines, I believe in his college and NBA career, where he had to lay down a few times before games. I think missed a little bit of time because of it. Is a migraine more than just a normal headache? I've never had one, and so I'm not the best person to explain it. So I wanted to ask you that because it's always in the news.
Count yourself very, very lucky that you've never had one, frankly. I am a migraineur, as we call them. I'm someone who's had migraines, and they're in my family, my father, my grandfather, my sister. So I am no stranger at all. But yes, migraines are extraordinarily debilitating, and they cause a large range of neurologic symptoms, which is why they're different than just a plain old headache. Plain old headache can be from almost anything, just a little bit of pain in your head. But a migraine literally can render you absolutely unable to function, and that's what's so difficult about them. They can cause vision changes. They can cause not only pain, obviously, but vision changes, numbness and tingling, other sensory changes, weakness, et cetera, et cetera. It's quite extraordinary. And more than anything, they literally render you at times absolutely unable to function.
Dr. Jarvis, thanks for sharing that term, migraine, or I hadn't heard that before. And then also, you mentioned a couple times that you had it in your family. So I want to just expand on that question. Is genetics part of migraine headaches as well? Can that be a factor?
Very much so. There's obviously the association, and I think there's still a lot of research being done. The jury is out as to what the exact genetics of it are, but it's definitely familial. And there are times when it just sort of pops up, but most of the time you really can. Almost everyone has someone else in their family. Oftentimes it's a sibling or a parent who has migraines. So yes, it definitely can be a genetic factor.
And you told us it's extremely deliberating. I can't pronounce that. I messed up on that one, but the listeners know what I mean because I always seem to fumble one at this time, kind of like our Miami Dolphins. But you mentioned that they're tied to genetics and the term migrainer. I wanted to ask you also if I can add on this question one more part. Are there environmental factors that we should be looking out for that may kind of spark a migraine?
Well, I think that everyone has different triggers, and I think it's one of the most important things when I sit down with my patients when I'm seeing them for the first time is make them log what's going on in their life at the time when they're getting their headaches, et cetera, to try to track down what triggers are. But environmentally, certainly, allergens can trigger migraines. Even fluorescent lights, for example, can trigger migraines. If you ask someone who has migraines if they will have a fluorescent light in their office, they'll be like, no, absolutely not, because it's something that is very, very caustic, if you will, to a migraineur. So there's lots of different things that can cause it and be triggers, if you will.
Now, I want to ask you also, who is more susceptible to migraines, a man or woman, a child, young adult, middle age, or senior citizen? If you could also say kind of what age range are most susceptible to migraine headaches?
It tends to predominantly be women. In general, it's sort of ages 25 to 55. Usually it's women outweigh men by about 2 to 3. More like 3 usually. And then after menopause, a lot of times women's headaches will die down a little more. And I think it's very much tied towards estrogen fluctuations, which is why women do get hit with this pretty hard at times. Children can have migraines. It's very interesting that children can have headaches, but migraines, they can have often migraines will present as abdominal and nausea, vomiting, etc. symptoms in children. So it's very important to know what you're looking for and to be trained to look for it, because children who have stomach problems may be coming down the pike to having migraines. But predominantly it is women, and predominantly between the ages of 25 and 55. And that's, if you think about those ages, they're very much estrogen related, et cetera.
We're here on Doctors Are People Too with Dr. Amy Jarvis, neurologist with the Miami-Dade Neuroscience Institute, and at the website mdnineuro.com. That's mdnineuro.com. One of the easiest website URLs around. You can contact Dr. Amy Jarvis at 305-932-2463. So that's the Miami area code, 305-932-2463. And her Miami-Dade Neuroscience office is at 1190 Northwest 95th Street, Suite 404 in Miami. I'll tell you, I've been there. And it's right at North Shore Medical Center. It's just I-95. You get off at 95th Street there, Northwest 95th Street. And I believe, correct me if I'm wrong, Dr. Jarvis, is about a mile west of I-95, right there on the south side of the road on 95th Street.
Yeah, they're probably half a mile. It's barely, it's a stone's throw, so it's a very easy place to get to, which is wonderful when you're commuting in Miami.
And let's stay on the topic of the hospital right there. That's North Shore Medical Center in Miami. Now, you're actually one of the directors at the hospital, and you are the stroke medical director. So can you kind of give us an insight of what you're responsible for in that role?
Certainly. One of the things that we're a primary, North Shore is a primary stroke center, and so that means we have the ability and have a stroke team who are able 24 hours a day to give TPA, which is a clot-busting drug, a thrombolytic, which means a medication that will bust clots, essentially. And so my responsibility there is to make sure everything is coordinated, to make sure things run smoothly, make sure the quality is continued to be high, et cetera. And I've been there for just over a year now, and we're doing wonderful things and going in wonderful places.
Dr. Jarvis, correct me if I'm wrong, but I did my homework and my research. TPA is tissue plasminogen activator.
Very good. I know, it's a mouthful. That's why we all call it TPA, because it's just easier to say that.
You know, I can't pronounce debilitating or the susceptible, but I can tell you we've had a hepatopancreatic biliary surgeon on this show, and I can pronounce tissue plasmagen activator. Funny.
Close enough, definitely. Close enough.
Awesome. And just a couple minutes before our break here, I just want to go back a little bit to migraine. I'm so fascinated with this because until I became a young adult, I didn't know anyone with it. And I'll be honest with you, Dwayne Wade suffering from this condition and seeing it affect him really opened up my eyes to it. Let's stay on age range, though. You're a neurologist. What age range of patients do you regularly see at your office there at the Miami-Dade Neuroscience Institute?
I will usually see patients who are 18 or older, but I will occasionally see someone who's younger because a lot of neurologic conditions, a child is really, a young adult, if you will, by the age of 12, 15, et cetera, is really, we're dealing with adult issues. So a lot of times I will have a pediatric neurologist who will say, hey, do you mind seeing this patient because, for instance, for migraines, because they're essentially an adult and we need to treat them more that way, and they're not perhaps as familiar as treating aggressively with migraines for children.
That's a good way of putting it, Dr. Jarvis. I mean, 12 to 15 years old, they can already be in, adult stages. I'll share with my listeners a kind of funny story about me. I was 6'1" at 12, and I could dunk a tennis ball in the basketball hoop, and then I never grew again. So I was definitely an adult at that age, so I would have seen a neurologist if I did have a migraine. Right before the break, I want to get into this, and we may have to break it off, and just if you would be kind enough to stay on the line while we take the break here in a minute. But let's see if we can get to the first part of this question. How is Botox administered, and what helps Botox treat migraines? I've seen it in the news a lot lately. I haven't had a chance to ask a doctor.
So Botox is it's a very cool drug, if you will. It's what's so interesting is that it's been used by neurologists for probably 30, maybe even 40 years now, and it's the neurologist who stumbled across the fact that it actually dampens or smooths out wrinkles. So when we were giving it, neurologists or ophthalmologists, et cetera, we're giving it for strabismus, for ocular issues and other neurologic issues. Then the cosmetic appearance happened to be noted, and that's when it became all the rage, of course, much later. The Botox is essentially what it does is it goes in and deadens paralyzes the muscle fibers. And so migraine is still really being researched extensively and is not completely understood, and there's various different thoughts about what causes it in different camps of thoughts, if you will. And but essentially what it does is it deadens and paralyzes the muscle fibers. And within those muscle fibers, when a migraine takes place, there are multiple different neurochemical events that happen and cascades of events that happen. And so by deadening that, you essentially are blocking a lot of the cascade of events and pain modulation, et cetera. So it's done in the office. It's a super easy procedure. It's a very tiny, itsy-bitsy needle, barely even the size of an insulin needle. And it's just injected in certain sites around the head, forehead, and neck, depending on what you're doing it for, obviously. But it's very effective. It decreases the number of migraine days that migraineurs have, and certainly decreases if you have chronic daily migraines.
Dr. Jarvis, hold that thought. We're going to take a quick break on Doctors Are People Too, and on the other side, we're going to talk about stroke, vascular disease, neurocritical care, neurotrauma, and women's neurological care on Doctors Are People Too.
I make a dinner for me and my girlfriend. We ate, we enjoyed. The dinner was very good. She was ready to go to sleep. I said, okay, I'm going to stay on the couch a little bit to watch TV. I started to feel something in my throat, like I was choking. And all this other, I feel the pain, the sharp pain, like somebody put a knife in your back and open and do like this. That was when I called my girlfriend. I said, you have to take me to the hospital. I couldn't die. When they were doing the test, they saw something Something was weird. My valve was ripped. I said, God, please help me to get out of this. Dr. Valle was on call. He was who performed my surgery. I describe like an angel. I describe like he was there to do that for me. My girlfriend, my son, he told me when they saw him getting out from the operation room, he was sweating. He was tired to be there for 10 hours. For me, it's unbelievable. I can walk, I can exercise a little bit, and I can drink red wine, that light red wine. Of course, 1 glass or 2 glasses. I see the life different. And I want to see my granddaughter to grow and my son to get old. So I wanna live. I think that God gave me one more chance in life, and I had to take advantage of this.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
And we're back on Doctors Are People Too with Dr. Amy Jarvis, neurologist at the Miami-Dade Neuroscience Institute. That's mdnineuro.com. And I just want to point out that migraine headaches are debilitating. And then also, I have to practice because that's the way I am. I'll practice it until I get it, Dr. Jarvis. Then also, 25 to 55-year-olds are the most susceptible. I'm not going to get that one, am I? I shouldn't have shown off. Susceptible. There it is. Susceptible to migraine headaches. Dr. Jarvis, thanks for coming back. The second part of that question before the break, how often is Botox needed for migraines? You said you can do it right there in the office. How often do patients need to have it done?
We usually do it every 3 months or so. And that's just because the actual Botox serum, the medication, et cetera, wears off in that period of time. And so by the end of 3 months, the muscles are reactivating, et cetera. So you're going to have the increase in that neurochemical cascade that I was discussing earlier. So it's done regularly, and no matter how many times you do it, you really don't have, the muscles always come back. People always are very afraid of it initially, and I'm like, no, it's not at all that way. It's not as it's perceived to be. So it's a very easy treatment, and it's extremely effective.
And Dr. Jarvis and her team at North Shore Medical Center and the Miami-Dade Neuroscience Institute, she can do the Botox treatments right there in her office. It's 305-932-2463, and it's at 1190 Northwest 95th Street, Suite 404 in Miami, right off I-95 on Northwest 95th Street exit. You're just going to go a half mile west on Northwest 95th Street, and it's on the left-hand side. The south side, you cannot miss North Shore Medical Center. It's a huge complex. Dr. Jarvis, thanks so much for being so helpful with migraines. I know that wasn't the main topic today, but something I wanted to hit on. I want to go to strokes are always in the news. Can you give us kind of a medical definition of what a stroke is?
Stroke, essentially, there's different types of strokes, but stroke is a disruption in the blood flow to the brain, and it can be either a blood clot that stops the flow, or it can be a break, a tear in an artery where your hemorrhage, the flow is changed because of a hemorrhage. So it's depending on what type of stroke you actually have.
Now, I also saw on the news today, as I was doing a little research on ABC News, how blood clot removal could help more stroke victims. I kind of want to break this into why is, I've heard the phrase time is brain, and then we've also heard the FAST acronym. Why is time so important in stroke care, or as you said, getting to a primary stroke center like North Shore Medical Center?
From the second that one begins to have a stroke, your neurons are dying, essentially. Your brain cells are dying, and you lose 2 million neurons in each minute after the stroke begins. So although we're blessed with many, many neurons, hopefully all of us, but it's so extensive, the damage, and so fast that it's extremely, extremely important to get the time at which you have symptoms to when you can get to a hospital, which can give you TPA or other interventions, is extremely important.
Now, Dr. Go ahead. I'm sorry.
I was going to say the FAST acronym is from the American Heart Association, et cetera. But it's a wonderful little thing. It's easy to remember. It's face, arm, speech, and I think there's a telephone, call 911. Time, essentially time, call 911. But basically, when a stroke happens, look at somebody's face. Is their face droopy? Look at their arm. Ask them to lift their arms like they're holding a tray. Does one arm droop down or drop down? Ask them to say something. Are they able to speak, or or when they speak, are they comprehensible? Can you understand them, etc. So that's where, and then time, meaning call 911 and get the patient to the hospital immediately. So that's where the FAST acronym comes from.
And I know from reading in the news that's something that the ENTs or emergency ambulance technicians and staff know to get to certain stroke centers in the area that they're they're taking care of, is what I want to say there. Dr. Jarvis, let's talk a little bit about vascular disease, because when I think of vascular disease, I got to tell you, I think of cardiovascular first, but I think this is more broken down maybe into the brain and neck. Can you go a little bit on that?
Sure. So vascular disease as a general term can mean any vessel in any part of the body. When you say neurovascular disease, then it narrows it up to essentially above the skull base and higher into the brain. And neurovascular disease can be anything, which includes strokes, because anything that can affect the vessels in the brain, it falls under the category of neurovascular disease. So it's actually quite a wide range of things that can do this. And it can be anything, like I said, from stroke, and you can inherit risk factors for stroke. It can be lupus. It can be various different autoimmune issues that can happen. All sorts of disease settings can cause vascular disease.
Now, thank you for that help on that, because I was a little off track there on cardiovascular, but I get it now. Neurovascular. So I can't say I've heard that term. So I actually learned something. I hope the listeners driving around did, and later on viewing amp2.tv as well. Now, what types of neurotrauma, you mentioned neurotrauma before, what types of neurotrauma cases do you see in the hospital setting? Are these like a car crash or maybe a fall and traumatic brain injury? Yeah,
a lot of times. I mean, we're not a trauma center per se, so the traumas that we see will be on the lesser scale. So minor motor vehicle accidents, falls. People fall from ladders, from trees, et cetera, et cetera, et cetera. All sorts of things, or just fall. Period, and you can have trauma. So that's the sort of things we see. We see a lot of concussions, a lot of subdural hematomas, which is bleeding underneath the brain, bleeding underneath the skull, over the brain, and then hemorrhages in the brain caused by trauma, falls, car accidents, getting into a fight or being assaulted, et cetera, things like that. We see a lot.
Now, are senior citizens and the elderly more susceptible? I said it. Susceptible to traumatic brain injuries?
Most definitely. As we get older and as we age, the arteries in our brain, the vessels in our brain become more brittle. And anything that's more brittle, of course, if it falls or if it's hit or anything like that, it can break essentially. And so they can fracture, rupture, break, etc. So they're much more fragile, and so that's why when the older you get, you do not want to fall for many reasons, but certainly to hit your head, because you can do serious damage. When you're younger, we as neurologists, we jokingly say, and it's not really a joke because it's the truth, that young brains bounce, and it's true, because young brains can recover from extraordinary things, whereas the older you get, you just don't have that ability to recover anymore.
Dr. Jarvis, I've never heard it explained better. That is just awesome work there. No, really, I mean, it's a bounce back. I mean, it makes total sense, and we know that if we get to see someone like you in a short amount of time, the brain has a chance to recover. That's true, right?
Right, absolutely.
Okay, and this is something I wanted. We're in Boca Raton right here, but we broadcast all over South Florida, and we have, there's more women on the earth than men. So I really want to touch on this topic. You also provide women's neurological care. I got to ask you, what is women's neurological care, and why is it important for women to have a neurological care plan and a neurologist in mind, kind of like they're maybe not so to like a primary care, but someone in mind if, they need to see a neurologist?
The one thing I feel strongly about is that women, because of our hormones more than anything, women have a whole set of problems unto themselves. And a lot of times it's not as well understood, or maybe not as thought about by our male colleagues, and not because of any fault or any wrongdoing at all. It's just something that happens. And I think being a woman and having gone through all of these things, you become acutely aware of how these things relate. And for example, like we just talked about earlier, the migraines and women with migraines, the estrogen fluctuations, et cetera. And then also even seizures. I mean, you can have catamenial seizures where around the time of the menstruation you can have increased incidence of seizures. So there's all sorts of hormones play such an enormous part of our complete health and body and everything and well-being. And it also plays a part in just everyday issues that happen. And if you have any sort of neurologic issue, it's definitely going to be affected in some way by hormones. So women need a little extra attention, I think, and especially when dealing with their neurologic issues. And I think it's really important that you see someone, and it can be a male or a woman. I have a wonderful male colleagues who are extraordinarily wonderful with women, but someone who's sensitive to women's needs.
I think that's Dr. Bashar Mohsen you're talking about.
That's definitely, he's one of my colleagues, yes.
All right, we're going to play the quick question round. I got 3 more questions in about less than 2 minutes. And I want to give your info out one more time. Is it true you are bilingual in English and French?
I am. I lived in West Africa, and I learned French there, so I'm fairly fluent in French. So my Haitian population and I get along very nicely.
I was just going to say, huge Creole population right there, Haitian Creole population right there near North Shore Medical Center. That is a no-brainer. They brought you in. Great job by North Shore Medical Center and Miami-Dade Neuroscience Institute. On to the next one, Dr. Jarvis. When you're not providing neurological care to the residents of South Florida, what activities or hobbies do you participate in?
Well, besides being kept very busy by my husband and my 7-year-old son and my dog, my husband and I started a not-for-profit foundation, and it's basically to encourage international relations and dialogue between businessmen, academic institutions, politicians, etc., with a focus on Latin America here in South Florida. It's called World Affairs Council of Greater Miami, and we're applying to be part of the formal council, the World Affairs Council of America. But it's a wonderful venue that brings together people from all across socio-political academia worlds and puts them in one room, and we have these fascinating discussions and lectures and roundtable, et cetera. So that's what we spend our time, and of course lots of other things too, but there's only so much you can fit in 24 hours, right?
That's true, Dr. Jarvis, and I'm definitely going to have you on again to talk about that. Last but not least, kind of a couple-word answer. What do you do to keep your brain active? I play guitar. Does that keep the brain active? What do you do?
I practice neurology.
Perfect answer to finish up. Dr. Jarvis, I want to thank you so much for coming on Doctors Are People Too. You're definitely the most informative physician I have had on the program. We just knocked 15 questions out of the park. Thank you so much for coming on Doctors Are People Too.
Thanks for having me, David.
And that's Dr. Amy Jarvis of the Miami-Dade Neuroscience Institute, mdnineuro.com. It's area code 305-932-2463, and on the campus of North Shore Medical Center there in Miami at 1190 Northwest 95th Street, Suite 404 in Miami. Thanks again, Dr. Jarvis, and we'll look forward to have you on in the future on Doctors Are People Too.
Sounds great. Thank you, David.
Hi, my name is Dr. Rahul Agarwal. I'm an interventional cardiologist in Jupiter, Florida. I did my medical school at the University of Florida and my internship and residency at the same program. I did my chief residency also at Shands, and then did my cardiology and interventional cardiology at Wake Forest University in Winston-Salem, North Carolina. I specialize in general cardiology, interventional cardiology, and nuclear cardiology. Even though I'm an interventional cardiologist, the majority of my practice involves general cardiology. General cardiology is a pretty broad spectrum in that it involves rhythm problems such as atrial fibrillation, heart disease such as coronary artery disease, congenital heart disease, high blood pressure, and cholesterol problems. I do procedures such as cardioversions, which involve trying to convert the patient back to a normal rhythm if they have an arrhythmia. I also deal with plumbing problems such as the coronary arteries, which if they're blocked, I can do angioplasty and stents, which involves balloons that open up the arteries. And these stents act as scaffolds that keep these arteries open. I really do believe in preventive medicine, and one of the areas that I really focus on is diet. One can really get caught up on the pills aspect and the exercise. And diet we talk about a lot, but unless one really has some guidance as to where to go with diet, it can be quite difficult. So I do give my patients homework in terms of books or movies that they can rent or obtain so that they can get educated. Our cardiology office is located in the Abacoa area of Jupiter, Florida, conveniently located between two of the local hospitals. We provide echocardiography, stress testing, ultra monitoring, and general cardiology office visits. We really pride our practice in its staff, who are very courteous and professional. We believe that under our care, you'll feel the same way too.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
Hello, South Florida and beyond, and globally on the iHeartRadio app. Welcome to Doctors Are People Too. You can also see the rebroadcast on amp2.tv on the YouTube channel. I'm sure we've all been there, so I believe it's youtube.com. Just type in amp2.tv and you'll be able to watch tonight's show whenever you'd like. Without further ado, I want to introduce Dr. Daniel Selps. Dr. Selps, thank you so much for coming back on Doctors Are People Too and, helping us out, informing us on foot care. How are you doing tonight, Dr. Selps?
I'm great, thanks. Thanks for having me again.
Thanks for coming along on Doctors Are People Too. And we had you on in August, and we touched on a lot of topics, but then the football bug bit me, and I'll be honest with you, I've heard more about Jones surgery in the last 6 weeks than I've heard about in my life. I didn't even know what it was until 6 weeks ago. So I want to ask you, you're a doctor of podiatric medicine, a podiatrist, but I know you do foot and ankle surgery at Well. What is Jones surgery, and is it something that you perform right here in Boca Raton, Delray Beach?
Absolutely. It's a very common procedure, actually. For most people that have to undergo it, it is an elective procedure, but there is a vast need for it when that type of injury occurs.
Now, do you normally see athletes, or is it the weekend warrior who may kind of fracture I'll butcher this, metatarsal?
Right, yeah, it occurs actually in both. The athletics get it, and the common lay person can get it being a weekend warrior and so forth.
Okay, I remember I was talking about basketball earlier because I actually used to play basketball, believe it or not. I used to be able to dunk a tennis ball. It's hard to believe now, but I fractured my fourth metatarsal, I think, a stress fracture. So this is actually a little farther out, more towards the pinky toe. Would that be correct?
Exactly. We label our metatarsals the same as the fingers, and the toes. So we have the first, second, third, fourth, and fifth, and the pinky is the fifth. And a Jones fracture is actually a fracture of that fifth metatarsal, but also at a specific area of that metatarsal where the blood flow is less, and that's why it got its own name.
And we're seeing this with Sammy Watkins, the first overall pick of the Buffalo Bills a few years ago. I know he's had Jones surgery and he's had issues after, And I'm thinking I've seen it in the Florida State University quarterback this year before Francois started. That, I believe his name is McGuire, also fractured his fifth metatarsal and had to have Jones surgery. And then I thought, man, I got to have a podiatrist back on because this is all they're talking about in both, college and pro football. So I wanted to also ask you in football, and I know you get weekend warriors as well, is this something that you get a foot stepped on by an offensive lineman, maybe a cleat into the metatarsal bone could cause that? Or is it more of like a contact, slap the ground, slap the helmet hit where the foot hits, a hard surface?
Absolutely. So it's more of a ankle injury in the foot than either of those instances. I mean, it can be caused by a trip and then a loss of balance, but when you roll your foot inwards, rolling the foot inwards actually causes the tendon to pull tightly in the opposite direction, trying to prevent you from twisting your foot or ankle. And in that motion, the tendon pulls so hard that the bone breaks at this weaker area. And that bone's actually weaker because there is less blood flow to that. We have an artery that comes from the toe side of the bone and an artery that comes from the heel side of the bone, and they don't quite meet where we classify a Jones fracture. So there's less blood flow to the bone at that area. The bone's weaker there. So when that tendon yanks on the bone can pop right at that weak area.
I was totally wrong. I was just BSing it and what I saw on TV, but I got to tell you, that's why we have Doctors Are People too, and we have doctors on the show, so we can take you on kind of an adventure in healthcare, but learn a little bit more from the doctor's point of view, someone who's doing this on a regular basis. And before I forget, I want to give out Dr. Daniel Selp's information. He's a doctor of podiatric medicine. 561-395-4243 is how you can contact him right here in Boca Raton. So it's at 950 Glades Road, Suite 2A, Boca Raton, 33431, and that's BocaRatonPodiatry.com. And Dr. Selps, you told me it was right across from FAU at Glades and University. Did I get that right?
That's correct.
Right around the corner. And, I was at the FAU football game actually yesterday. Got moved to yesterday. There were a lot of injuries, I got to tell you, on the field, but I didn't see any foot injuries, so I don't know if any owls will be coming your way. But I want to go back to Jones surgery. I was doing some research on this because I had pitched you to come on the show to talk, starting out with the Jones surgery. And I tell me if I'm wrong, if you studied this in medical school. I mean, this is coming from, I have to say, I wasn't the big journalist on this one. I went to Wikipedia, but they're mostly right most of the time. Named after Sir Robert Jones, an orthopedic surgeon who sustained the injury to himself while dancing back in the early 1900s, and he published it in the Annals of Surgery in 1902. Have you heard that?
Yeah, that's very similar to the story I remember hearing back in podiatry school. There's a story that he had recognized the injury beforehand, and unfortunately, I think he got it while dancing. It's actually termed for some people a dancer's fracture. The same reason, if you're light on your feet and your foot has a twisting inward motion, you can roll your foot and that tendon response can crack the bone right there. So it's also termed a dancer's fracture as well, pulling the bone off from that metatarsal.
He was literally cutting the rug back in the early 1900s there.
Yes,
I wonder what kind of music he was listening to. I mean, they didn't really have the types of music we have today. So it must have been interesting that night. Last time you were on the program in August, we talked about how you got involved in medicine, that how you're from a family of doctors, your medical school background, training, and residency, but we didn't get to talk anything about, and this is kind of a weird word, sometimes it feels like bunions, but this is something that can be very annoying. It's can it be painful, and what is a bunion? Is it a foot disorder?
A bunion is actually very common. It's one of our top common complaints in podiatry. We see bunions and a lot of heel pain, probably being the number one painful complaint in the office. But bunions are a structural deformity of the foot. It starts where the first metatarsal on the other side of the foot, having talked about the Jones, the first metatarsal abnormally shifts inward towards the center of the body. And by the bone shifting inwards, it creates that large bump that you see next to the big toe area. And it's often caused by an abnormal biomechanical process where the foot is rolling abnormally. As you walk from heel to toe, the foot's actually maneuvering abnormally in what we call a pronation style or overpronatory style type of gait.
Wow. So if this is the metatarsal, it's that first bone coming towards the second one there, I think is kind of the way you explained it. You'll have to help me out. But
Sure.
Is that correct? And then also, how are bunions treated? Is it something you can do in the office here in Boca Raton? Is it outpatient surgery or?
Absolutely. We have to evaluate each person's case by case. It often involves looking at the person, seeing how painful it is, taking an x-ray and seeing what type of structural deformity is present with the bone alignment. Most times bunions are a form of arthritis, so there's an arthritic component to bunions as well that we have to evaluate and make sure that the person's aware of potential arthritis pain that's associated with it.
And if we see something that's abnormal on the foot like that, can we make a appointment directly with a podiatrist, or do we go to our primary care and get referred to someone, an expert like you?
Sure. Most people can just call our office directly and come in and be evaluated. There's many things we can do for the bunion once we see it conservatively and surgically to correct it, if that's the goal. But as far as getting into the office, you can call my office directly. Some insurances require the referral from the primary doctor, in which case you have to go to him or her first. But we start with the x-rays and the workup from there.
And Dr. Self's office can give out that information. You're going to want to call 561-395-4243. Let me say that again. 561-395-4243. That's Dr. Daniel Selps, podiatrist, specialized in also foot and ankle surgery at Boca Raton Podiatry at 950 Glades Road, Suite 2A in Boca Raton. If you know the area, it's right across from Florida Atlantic University at Glades Road and the intersection of University. Dr. Selps, we're going to take a quick break in about a minute, so I want to see if we can break this into two. What is the correlation between foot disorders and diabetic foot care? I know this is a special area of interest for you, and you do a lot of work to help people with diabetes. So what's that correlation? How does that happen?
Sure. Well, the foot disorder is more of a very broad term. So it can be anything from an ingrown toenail could be a foot disorder to a bunion is a type of foot disorder to any kind of pain or problem. When you mix that with diabetes, there's oftentimes much worse complications that can occur from those disorders, which if you didn't have diabetes, which makes you more at risk for decreased circulation or neuropathy, which a lot of people are becoming more familiar with that term neuropathy. If you have any of those, which is very common in diabetes, you're at greater risk of greater complications from any of these disorders.
Well put, Dr. Selps, and hold that thought, and we're going to be right back on Doctors Are People Too.
My dad is a cardiologist, and so I have two brothers, and we were all equally painful to my mom. And so to get us out of the hospital, we would go on rounds with him on Saturdays and Sundays in the hospital back in Oklahoma City. And we used to, race wheelchairs down the hallways from the time I was about 6 years old. When I was a freshman in high school, I got to watch my first heart transplant. But I think what really kind of made me want to be a doctor was around the holidays. The house always filled up with tons of gifts from thankful patients, and to impact people's lives like that in a positive manner was something that was very exciting to me. I'm very patient-oriented. I care about the patients both professionally and personally, and not only about their result, but also that I'm passionate about new technologies. I'm passionate about research, and I'm passionate about offering them the best technology available with the lowest risk and with the best outcome. What you want in a physician is someone who is personable, works as a team, embraces new technology, is clearly accomplished, but I think most importantly is somebody who you get confidence in. And the way I would have confidence is if I had a condition, I would read as much about it as I could before I showed up, probably off the internet, and then ask very directed questions. I do a lot of exercise. Running is what I use to kind of calm my brain down and kind of sort my thoughts out. So I enjoy, I just will put my shoes on and go for a run, and then I do mix in a little bit of yoga, something probably not many people know about me. I keep that on the down low, but I do some yoga, and I go to the gym like most people.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
And we're back on Doctors Are People Too on iHeartRadio and on amp2.tv. And lucky to have in the studio a podiatrist right here in Boca, doctor of podiatric medicine, foot and ankle surgeon, Dr. Daniel Selbst, right here in 950 Glades Road, Suite 2A in Boca Raton, across from FAU. Dr. Selbst, we talked a lot before about the Jones surgery, and it's been in the news lately, but I didn't really ask you how the surgery is performed and, how long is the recovery time?
Sure. So the surgery, for people that are having the surgery, it's a relatively quick surgery. It's about a 30-minute procedure where the bone is reduced, and oftentimes if it's a single break, the person gets what's called an intramedullary screw, which is a screw that goes down the shaft of the bone, and that screw helps compress the fracture. Once that screw's in place, most doctors, I believe, keep the person non-weight bearing for about 2 to 3 weeks, and then you can do some crutch-assisted walking for the following 2 to 3 weeks. But generally, you're not putting your full weight on it for almost 2 months, and then you gradually, after that, work your way back to full activity.
Wow, I didn't know that. So 2 months, yeah. But then, it can be back to normal or better after a full recovery?
Absolutely. The thing with the Jones fracture is that Jones fracture has been classified again that it doesn't heal well typically, and that's because there's less blood flow to the area. With this surgery, it helps reduce the risk of delayed or non-unions. By having the surgery hold the bone together. We know that bone heals with time. So on average, our bones are naturally made to heal at 8 weeks. We grow bone at 8 weeks after an injury. If you have the surgery does two things. It stabilizes the bone just like a cast would do. A cast helps hold our bones from moving, but it does something more. It compresses the bones together, and by compressing the bones together, we also have many studies showing that actually helps grow bone even faster. So that's how that screw fixation works. Other people get various wires if the bone's broken, and there's some plates for it as well if needed. But most people just get that intramedullary screw, which is a relatively very good and quick surgical fix for it.
There you go, all you fantasy football players. You can quit texting me over and over about when your player's going to recover from Jones surgery. But we do have Dr. Selbst in studio here at 188-565-1470 if you want to call in. He's a doctor right here in Boca Raton. Dr. Selbst, we also talked about bunions, but I didn't ask you about the surgery for bunions and then timetable for return. And then also, do all bunions require surgery?
Sure. So most bunions that are painful in any shoe, that's usually the key word I'm looking from my patient to initiate the conversation about surgery. When they tell me they can't find any shoe to wear comfortably, meaning the width can't fit their foot shape anymore as the bunion's growing, that's usually the time that we discuss surgery. As far as surgery go with podiatry is a great field because most of the surgeries we do, we have ways that we can allow people to weight bear or walk right after surgery. Sometimes they wear a little brace, but they can, depending on the procedure we do, most times walk right out of the surgery center if they want to.
Now, we've touched on Jones surgery, talk a little bit about foot disorders, and we'll get to that in a second. Bunions as well, something I wanted to hit on because we didn't have time last time to talk about it. I want to ask you something, though, I'm always concerned about when I'm not, getting a pedicure, and I will get one and a manicure too. They're awesome, I gotta tell you. But is ingrown toenails, because I always think sometimes, man, I didn't clip that right. I don't, know what's going on here. Do you treat ingrown toenails, and what is kind of a normal treatment for that?
Sure. So we see a lot of ingrown toenails. That is actually one of our other major, often common complaints in the office. Ingrown toenails are caused by the irritation of the skin next to the nail, oftentimes worsen as we walk or by shoe wear. Most people get ingrown nails of the feet or in the toenails versus in the hands, and that's because there's more rubbing of the skin pressing into the nail. So oftentimes for the surgery for that, it involves removing that nail from that skin fold and allowing the skin to fully heal. We do that either by clipping. Sometimes we have to numb the toe to clip it. And for people that have a chronic problem where it keeps recurring and recurring, we numb the toe, clip the nail, and also we put a little acid or have a device that burns the root of the nail in just that corner so that the nail doesn't grow in that corner anymore, and the nail hopefully won't become ingrown again.
Is an ingrown nail possible from just clipping your toenails wrong?
It can be, absolutely. So if you leave either a little hook or if there's a different angulation, the way that the nail is pressing into the skin, or as you walk, the skin gets pressed into the nail, whichever way it may be, if that causes skin irritation over and over and you don't change something by changing the shoe, or I tell some people with mild ingrown toenails they can just use Vaseline or bacitracin on the nail and skin fold to help protect it. And if those don't help it, then oftentimes the nail corner or the side of the nail needs to be removed to allow the healing process to continue.
Vaseline, always good to have a non-surgical treatment if we don't have to come and see you for that one, because that sounds like kind of a tough one. But I know you do a great job. And you were telling me before that you even did a few house calls for ingrown toenails because, well, let it explain to you, because the insurance has allowed you to do it because a couple patients couldn't actually make it into the office?
Sure, absolutely. I mean, I have a few patients who, for a few reasons here and there, that have been established through my office, and if something happened where they became homebound and they have a foot problem, I try to help them out as best as I can. And I actually had a few people earlier tonight that had that exact issue. They had that ingrown toenail.
Yeah, and I'm glad they took care of it before it got worse. We're here with Dr. Daniel Selbst, Doctor of Podiatric Medicine, 561-395-4243, right here in Boca Raton. Easy way to take a look at him and his staff is BocaRatonPodiatry.com, and they're located at 950 Glades Road, Suite 2A in Boca Raton, across from FAU. Dr. Selbst, thank you so much. We're ripping through so many great topics here tonight. And another thing we didn't get to touch on last time we talked is orthotics. What is an orthotics? And you can help a patient have a custom mold made. I mean, you have the resources to reach out to your experts and help patients with, I guess, the way their foot sits and maybe a shoe or other. Well, I'll let you explain a little bit.
Absolutely, yeah. Orthotics are a great topic. I mean, we use orthotics to treat a number of foot-related conditions, injuries, and biomechanical problems, as well as even just alleviating pressure for people that have chronic calluses and corns and so forth. So orthotics, what an orthotic is it's a device that goes in the shoe. Most people are familiar with the standard insoles that come in the shoes, and an orthotic oftentimes will replace that and enhance the way that the foot functions in the shoe. I tell people that orthotics are for the feet as eyeglasses are for the eyes. If your foot is not working correctly, you need this device to help your foot balance and work more correctly. Just like if you can't see very clearly, the eyes need assistance. You put the lenses in front of the eyes, and then you're able to see more clearly. Same thing with the foot function.
That's a great way of explaining it, because that hit me, because I just needed glasses last year for the first time. And, when I have a foot problem, I'm going to go to you because I'm very confident in your expertise here. And then that was a great explanation on orthotics. Now, we have a couple more minutes, so I want to get into some of the types of outpatient surgeries you do perform. I know we talked on Jones surgery, but are there any others? And then the B part of that question is work-related injuries that you treat on a regular basis.
Sure, absolutely. Well, before we go on to the surgery, the orthotics are oftentimes prescribed to people for a lot of the reasons that we do surgery. So I definitely try to fit them in, but we do surgery on people with bunions, of course, and anybody who has a bunion or needs bunion surgery should still consider getting an orthotic, because the orthotic helps control the motion. A lot of people that undergo bunion surgery, maybe 5, maybe 10 years later, have the bunion recur. The surgery may have been done perfectly, but the fact is a lot of times the foot still functions abnormally, even though that the bunion is missing. So if the foot still rolls inwards, which is that pronation motion, the orthotic actually helps support the foot in that better position, helps you walk over the toes more properly. So bunion surgery is very common. Hammer toe surgery, very common. Heel pain is treated with orthotics commonly, but if it fails, we do several surgeries for that. One, we actually have an endoscope where we are able to see the plantar fascia with a camera and able to very finely pinpoint where we're cutting with minimal incisions. So that's one option. Another surgery that we have very common are the ingrown toenail procedure. We'll take out neuromas, and then there's, of course, the non-elective stuff where people have acute injuries, tendon ruptures, tendinitis, bone fractures, ankle fractures, metatarsal fractures. So we see a wide gamut of surgeries.
Perfect, Dr. Selbst. We're going to have you on again in the future. It's Dr. Daniel Selbst at Boca Raton Podiatry.com. Thank you so much for coming on the program.
Appreciate it. Thank you for having me.
Awesome.
Thank you for listening and watching Doctors Are People Too with David DiPino. Join us next week for more in-depth views on what doctors are all about and how they spend their free time. All shows can be seen on amp2.tv. And if you have questions you want answered on the air, call 866-224-5422 and leave a message that can be read on the air. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Talk 1470.